Good morning, everyone. So my name is Wayne Brewer. I am a physical therapist. I am also a heart failure patient. And I've been a heart failure, whoops, I went too fast. Us physical therapists tend to do that. So I've been a heart failure patient now for the past 3 years. And it's a little bit unconventional in terms of how I developed the heart failure because it's not quite clear in terms of the risk factors. I didn't have any risk factors. I didn't have a family history other than my dad had a heart attack. But the traditional high blood pressure, diabetes are things I didn't have, and I was also very physically active. So what brought me to have medical attention was the fact that I had a gradual decline in my ability to perform physical activities. And I also noticed that my heart was skipping beats. I had that palpitations or just irregular heartbeat. And then a couple of times after workouts, I actually felt lightheaded and dizzy. So I had this traditional physician workup, the battery of tests I'm sure that many of you have had, and I was diagnosed with dilated cardiomyopathy, or the type of cardiomyopathy where the heart's not pumping blood. The heart was really weak. So my immediate reaction was very difficult for me. At the time, I was 44 years old. I'm 47 now. In many ways, for me, it was disappointment. You know, I felt that I was doing everything that I possibly could to keep heart disease at bay. And so when that didn't happen for me, it was very hard to really face that. Also, being married and also having 2 children, just the fear of the future and just the unknown. And once again, as a physical therapist, I've worked with many patients in the hospital who have had heart failure, heart attacks, heart disease of various magnitudes. But to sit on the other side of the bed, if you will, was very difficult. And so in the process of trying to explain this to my friends and family, you know, heart failure is something that's not quite clear to many people. Many people understand heart attacks, but don't understand what heart failure is. So the process of trying to explain it to people also I felt was very daunting. And also just the fact that people looked at me and said, well, how does this happen to you? You're too young. I just kept hearing the too word. You're too young. You're too active. You're too this. You're too that. So that was difficult to try to be able to explain that to individuals. And then once again, just the impact on my family, just from the emotional aspect, to be able to try as best as possible to keep these feelings from my young children. And at the same point, having my wife to lean on, who also was someone who didn't have an understanding of what this was all about. So it was a lot of denial. So when I first was diagnosed, and I remember the physician gave me the medication to take, I refused to go to the drugstore. I said, I'm not stepping foot in Walgreens, okay? So my wife said, well, you know what? After she slapped me across the head a couple of times, she said, you know what? I will go to Walgreens and I will pick up the prescription for you. So as I sat at my desk, just sort of looking, gazing, and just trying to figure out just why me? Why did this happen to me? And she sat the medications in front of my desk, and I sat there and looked at those for about an hour and said, you know what? It's come down to this, and we need to confront this, and we need to start the process of trying to heal. And so I've been on this journey, and this is going to be a lifelong journey for the past 3 years. And so one of the ways that I cope with this is trying to educate myself about the disease process. So forums like this are really valuable. But also I would say in the process of educating yourself, you as the patient, also realize that there's a lot of good information out there, and there's a lot of information that may not apply to you. So it's really important to have that relationship with your physician, to have an open dialogue, to continue to enhance your understanding. Because just as Dr. Bimaraj said, it's more so what you do outside of the hospital walls, which is what really matters here. And in the process of educating yourself, it's also the ability to learn to take control of your life again and to have a plan. So with that plan may be a lot of different things. A plan to learn how to manage yourself when at times you're not feeling that well, both physically as well as mentally. And also allowing yourself to have times of sadness as well as times of happiness, because you deserve this. But if you have those times of sadness, because like anything else in life, there's peaks and there's valleys, is to have what I call the escape hatch. So back when I was about 5 or 6 years old, I used to watch Star Trek. They had this emergency thing when they get in the hatch and they press the button, they eject themselves from the danger. You need to find that escape hatch for yourself. For me, it still is exercise. Yes, I've modified the exercise that I do, but for me, it's a sense of taking back control, having a sense of normalcy again. For you, it could be a lot of different things. It could be looking out the window at a nice sunny day, taking a walk with your spouse, going to the movies. Don't forget about those things that make you who you are. Have that escape hatch and have it built in and have it readily accessible. Also, build your team. Just like any athlete, just like any successful person, it's very difficult to do this by yourself. Have your team. This is what my team looks like. And at certain points in the process, I lean more so on some people than I do on others of the team. But it's very important in order to successfully manage this that you have to have that team around you. So my life currently, so it's a lot of reflection. I reflect back on good things. I reflect back on things that I could have done better. And I also think about the future. I also continue to think about goals that I have for both myself, my family, my children, and also learn to be satisfied with where I'm at in life. I've also learned to laugh at myself, laugh at my imperfections. My son laughs at me all the time when he sees me trying to shoot a free throw. Okay? And I've also learned to excuse my imperfections. I've learned to give myself a pass, if you will, on many things that, let's say 5 or 10 years ago, that I was so rigid about. And then learn to derive enjoyment from the little things. It's the little things that really makes a difference. And learning to not sweat the small stuff, because once again, keeping stress down, keeping stress at bay becomes very, very important. So once again, these are things that I do to cope. So basically, in summary, heart failure is manageable. Learn to educate yourself in the various treatment options. There's a lot of research that's going on about heart failure. And we are blessed to be in a medical center such as this, where there's numerous clinical trials and research that's going on. So talk to your physicians about those things. Have an open dialogue and develop a relationship with your physician, and not just only your physician, but also your team. Your team, that team that I talked to you about, whether it's the clergy, whether it's the church, whether it's your friends, family, have the open dialogue, because that becomes really important to learn how to manage this. And then once again, as I mentioned before, believe that you deserve to have a happy, productive life. You deserve this. And as I mentioned, have that escape hatch. Have that escape hatch readily available for those times when you're in that valley, you need to come out of it to be able to do something to reward yourself and to make yourself feel better. So once again, I'm Wayne Brewer, and like I said, I've had heart failure for the past 3 years. If anybody wants to contact me, I certainly would welcome the opportunity, because once again, it's building a team and it's also building a community, and that's what we are. Thank you all very much.